So this is a repair case. He had 2 surgeries done elsewhere. The strip's put too low on his head. Can you show that? And the scar's wide. So we had a long talk about whether to do a completely new strip up where they ought to be, or to cut this one out. And there's no right answer. The advantage of taking this strip out, or this scar out, is you only have 1 scar, but it's a kind of a crappy scar in a bad location with weaker hair. And the argument for new scar up in normal location is better scar probably, and certainly better hair, but with the downside of 2 scars. So we agreed to excise just above his current scar. We'll sew up to that and get good quality hair. It's a small repair case, so I think we can get him a decent scar and decent hair. Okay, so the strip came out easily, didn't bleed much. And this is where we're going to put the hair. We're just going to pack that first 1.5 centimeters and try not to hit and hurt any of the hairs he's paid for elsewhere. It's just not dense enough. Okay, so we got this fellow pretty much numbed up on the front. And trim the hair so I can get real close and make holes between these low density grafts on the side and just pack it. And although I'm going to do my best not to hit any of them, we'll probably hit a few, but more likely is just the trauma from me making the holes and the girls putting in the grafts. About a month from now he's going to have some good shock loss in this 1 centimeter. But 2 months, these hairs will be back, and 4 or 5 months the new stuff will start to kick in. So I've made all the holes as close as I can to the grafts that he's already paid for. And you can see that right here, there's just not much density, but there's a bunch of holes there. We get these hairs in, and we just put the PRFM in, and this should turn out good. So we just finished up packing, and the reason it doesn't look quite as dense as the virgin head is because there's areas where he doesn't have any grafts, and that's where he had hair before, where we worked around those hairs. That should do well. And we got 1,397 grafts, which is more than we needed from a thin strip, so this should turn out good in 13 months. Okay, so this fellow's now a week out, and he's done a great job cleaning. You can see where we did our scar, and that ought to turn out well. I just have tried to beat it into his head. He needs to use vitamin E twice a day, and although the scar's a little on the low side and we sewed right up to his old one, I think if we do that, he's not going to get any worsening of the scar. Maybe we get a little improvement in his old scar. And his hair covers it well. So he stayed at a hotel all week and doesn't want anybody to know. So what we did was we just left this hair long in the front, and you can't see anything that's going on. And when you rub your hands up there, so hey, look there. He's got. I mean, this guy has done one of the best cleaning jobs ever, and I was a little worried about that. You know, I'm always stressed when these guys that are repair cases with high IQs come in here. They're not going to listen to me. But that is perfect. There's no reason this won't work. It's just a time game now.